I'm Dr. Gregory James Hummer. I'm a trained trauma surgeon and the CEO of Simplicity Health Plans. We're in a big mess in the United States today as it pertains to healthcare, in particularly health insurance. And this short series of videos will help you understand how we got to that situation. 4 factors account for 70% of the chronic disease in the United States: high blood pressure, cholesterol, overweight, smoking. 8 out of 10 Americans today are relatively healthy and will spend no more than $700 to $800 in a year, and that includes families, which means the other 2 out of 10 spend most of all the resources that we have available. Currently, our healthcare expenditures are well over $2.2 trillion. This video will consist of 3 main components. The first will be the history of healthcare and how we got into this mess. The second will pertain to how to fix it. And the third will be information about Simplicity Health Plans and how we can offer a solution to the problem. Thank you for watching the videos, and I hope you enjoy them.
From the 50s to the 80s, the United States experienced unprecedented growth in business and technology. Money was plentiful. Earnings were up. People made a lot of money in the stock market and with their real estate. With this great success came a proliferation of service companies, companies who helped make things easier and better, companies who watched over others' business and managed others' money. They didn't produce anything material as a factory would. They simply helped others with services to make lives easier and better, and they charged fees for their services. With all the growth in our economy, the real cost of these services lay hidden. There was plenty of profit for everybody. The whole world looked to the United States for leadership in all facets of business and services. War-ravaged nations throughout Europe and Asia imported American goods and technologies to rebuild their economies. Americans profited greatly, and they enjoyed the luxuries of success, which carried with it more comprehensive benefit packages, more vacation time, better health insurance, dental care, vision care, and mental health care. The healthcare industry was now a vital part in the business world. New technological companies developed new inventions to diagnose and treat patients. Profound discoveries in medical research introduced a new variety of machines, new drugs, and new ways of practicing medicine. With no surprise, Americans were becoming wealthier, and their lives were prolonged with the better care they could afford. With such abundance also came convenience, and the American people as a whole became less physically active and more dependent upon fast foods. Nutrition suffered. With this kind of abundance, and with the advances in technology, the federal government started legislating health care for the poor and needy. The cry then is the same cry as now. We are the most wealthy country in the world. We should take care of everyone's health. Since the founding of our nation, no legislature was able to socialize health care, but in 1965, President Lyndon Baines Johnson introduced a form of socialized medicine when a Democratic-controlled House and Senate passed the Medicare and Medicaid health reform legislation. This legislation covered major segments of the public with health insurance, and it was paid for with higher taxes. Although the medical associations resisted this legislation, the greatest benefactor was the medical community, as they no longer had to fund charity cases on their own. By 1969, 50% of all medical billing fees were being paid by insurance plans. By 1980, the U.S. government had become the largest buyer of healthcare services. Within a few short decades, from the 1960s to the 1990s, in addition to the Bill of Rights assuring us of the right to life, liberty, and the pursuit of happiness, a new right emerged in American society: the right to health care.
Thank you for watching this segment. Be sure to tune in to the next clip.